Setting: Community Health Center. You speak to a parent of 3-year-old girl who is going to undergo surgery next week to insert grommets in both ears. The parent got a letter stating the surgery date and pre-admission instructions. But he has some concerns about the fasting requirements. The child is not present. Now, let's look into the task. First one says, find out the reason for the parent's visit. Second one says, explain the importance of fasting. Cough, gag reflexes, listened with anesthesia, risk of vomiting and aspirations of food, liquids from stomach, operation needs to be rescheduled if not fasting. Third one says, remind the fasting requirements, no need for milk for the last 6 hours before the surgery and no clear liquids before 2 hours continuing oral medications, etc. Remind parent that the option of clear liquid, apple but now orange juice, etc. Reassure parent about the child's rehydration, IV administration during the post-operation. Sixth one says, find out if the parent has informed the child about the operation. Seventh one says, advise the parent to explain the operation to the child. Cream applied to the back of your hands, sharp scratch, deep sleep, etc. Recommend the parent to explain benefits to the child. A better hearing, fewer infections. The last one says, explain the discharge requirements. Full recovery from anesthetic, able to tolerate food, fluids, passing urine. Let's begin the role play. You can start like, good morning, my name is Alex. I'm one of the registered nurses in this community health center. Please be seated. Then interlocutor may respond saying, good morning nurse, thank you. Then respond saying, may I know your name for a better communication? Then interlocutor may respond saying, I'm Mac. Then respond in, okay Mr. Mac, may I know the reason behind your visit? Then interlocutor may tell you like, nurse, I got a letter regarding my daughter's grommet surgery. It says that the surgery date and the fasting requirements. However, I'm a little confused with that, so I need a little more information regarding that. Then responded saying, okay Mr. Mac, I'm happy to explain you that. Firstly, let me explain to you what is grommet. It is a small tube that is placed in your child's ear during surgery. It drains fluids away and keeps the eardrum open. The grommets usually falls out naturally within 6 to 12 months of your child's ear gets better, and the surgical preparations are similar to the other surgeries. I hope you're following me. Then interlocutor may ask you like, yes nurse, but your letter says that she needs to do fasting before the surgery. As you know that fasting for a long time for a 2-year-old child would be really difficult. Do you think that is necessary? Then respond him saying, being a parent, I really understand your worries. Mr. Mac, don't be overly concerned. Let me explain to you that in detail. It is very important for every patient to have an empty stomach before any surgery or procedure that requires anesthesia. This is because when the anesthetic is used, your body's reflexes are temporarily stopped. If your stomach has food and drink on it, there is a risk of vomiting or bringing up food into your throat. If it happens, the food could get into your lungs and affect your breathing, as well as it may cause damages to your lungs. So, it prevents unnecessary complications during surgery, such as cough, gag reflexes, and risk of vomiting due to anesthesia. Moreover, if you don't do the fasting as advised by the doctor, we would need to reschedule it. That is why the fasting is very important before surgery. Okay, Mr. Mac, I hope you're following me. Then interlocutor may respond saying, okay nurse, I was really unaware of the importance of fasting. Please let me know how long my child should stay without milk or food. Then respond him saying, I can sense your feelings, Mr. Mac, what you're going through. It is mandatory to avoid food and milk products 6 hours before the surgery. Apart from that, you need to stop clear liquids for 2 hours before the procedure. However, you can continue oral medications as advised by the doctor. Then interlocutor may ask you, okay nurse, I'm really worried as my child may feel really hungry and thirsty. I think she will have a hard time coping with this. Then respond him saying, I acknowledge your worries Mr. Mac. As mentioned before, you can give her some clear fluids 2 hours before the surgery. Then interlocutor may ask you like, okay nurse, unfortunately, I do not have any idea about what is clear fluid. Please let me know what is it. Then respond him saying, I'm happy to explain you that Mr. Mac. Clear fluids that are easily digested and do not leave undigested residue in the intestine. For example, she can have some apple juice but no orange juice. I can assure you that your child will receive intravenous fluid before and after the operation. So she will be completely hydrated. So do not worry at all. She will be completely safe in our hands. Interlocutor responded saying, "Thank you, nurse, for your support. I'm a bit relieved now." Then responded saying, "Okay, Mr. Mac, can you please let me know if you have informed your child regarding the surgery?" Then he may tell you like, "No, nurse, I did not. I don't know how to inform her. I'm really confused. I'm not sure about it." Then responded saying, "Okay, Mr. Mac, if I were you, I would react in the same way. Don't worry, I can help you. Tell her that a cream will be applied to the back of her hands and prepare for slight scratch before she goes to sleep. But tell her that it is not at all painful. Along with that, I strongly recommend you to let her know the benefits of the procedure. That is, she will have a better hearing and much lower chance of getting an infection." Then interlocutor may respond saying, "Thank you, nurse. I'm sure that my child will appreciate that." Then responded, "I'm happy to hear that, Mr. Mac. Do you have any other concerns?" Then interlocutor may ask you like, "I would like to know more information regarding his hospital stay and discharge formalities." Then responded saying, "I completely understand your anxiety, Mr. Mac. However, I'm not the authorized person to confirm about the discharge. Don't worry at all. I can assure you that when your child has recovered completely from anesthetic effect, she is almost ready to go home. And before discharge, it is important that she tolerates clear fluids and light foods. In addition, it is also mandatory that she needs to pass urine. I hope you got an idea now." Then interlocutor may agree with that. Then ask him, "Okay, Mr. Mac, do you have any more questions?" Then interlocutor may tell you, "No, nurse, I don't have any more questions." Then respond to him saying, "Okay, Mr. Mac, until now we have discussed about the pre-requirements before the grommet surgery. I hope you understand that. If you have any more questions or concerns, you can contact me at any time. I'll be glad to help you. So thank you, Mr. Mac, for your visit to Community Health Center. I wish you a great day."